the long extensors of the foot. And actually, you guys already know what those are. There are short extensors of the foot that live in the foot, and we haven't gotten to the foot. We're actually going to get to the foot next week. We will start it. And then you go to clinic or externship. And then we're going to come back for your last class, and we'll do feet, and we'll do arms, and forearms and hands and head and neck kind of stuff. So today there's actually only two muscles we're going over today, and you should already know, since they're extensors, since they extend out, hold on, somebody got kicked out, I gotta let them in. Since they extend out your toes, they live on the front, on the anterior side of your leg, because that's where a muscle would have to be to pull out your toes, right? And we've got the extensor digitorum longus and the extensor hallucis longus. And your entire presentation day is on those two muscles. So we're obviously going to do some review today, because I don't think it will take us an hour and 38 minutes to go over those two muscles. But I do want you to be aware of them. They're very important. Picking up your toes is very important, by the way. Every time you guys take a step and you swing your leg forward, you have to lift your foot and your toes up, otherwise you literally drag your toes on the ground. And you might have even seen somebody do this or had this happen yourself if you've ever pinched a nerve in your back. You'll kind of get like drop foot, and you can't pick your foot up. And so people will walk this kind of funny walk where they don't want to drag this foot through, so they'll kind of hike their leg up. Sometimes that's why they're doing that, is because they can't pick their foot up. They can't lift their toes up. And so the extensors of your toes and big toe are actually very important just for that fact, just in walking, to kind of pick your foot up out of the way. And so we'll talk about those today. But let's do some review, because we're coming close to the end of this course. Because after clinic, the course is over. And I want to make sure that we go into the last course with some remembrance of anatomy. So today I'm going to be mentioning stuff and calling on people. I'm going to try mentioning stuff first, meaning asking the question first, and then calling on somebody second. So be ready to chime in, and we'll see how this works. And I'm going to ask about bones too. Remember bones, those hard things underneath the muscles? Yeah, okay, I think you do. And make sure we have all that too, and just kind of talk about some stuff too. So, for example, I might use this because it kind of helps you know where I'm at. Yeah. Just so you can see me, let me point this down a little bit too. La da da, la da da. Oh, good. This is perfect. Good. All right. Okay, so you might want to pin me to your screen. But for example, this yellow disc here, I have it on top of what bone? Miss Rader?
The humerus.
The humerus. Is it easier to see red, by the way, against red better? I don't know. The humerus. Excellent, excellent, excellent. Okay.
Yeah.
This red disc I have over what two bones, Miss Hendrickson?
The radius and the ulna.
Yes. Which one is going to my thumb?
The radius.
The radius. Thank you very much. That's awesome. This red disc I have over which bone, Miss Stevens?
The femur.
The femur. That's awesome. Thank you. This red disc I have over what two bones, Mr. Richards?
So you've got your tibia and the fibula.
Fibula. Which one is more lateral?
So the lateral is fibula.
Yes, the little teeny bone, everybody, is on the outside. That's the fibula, which is why the muscles on the outside are called the fibularis. So the tibia is more medial and bigger. Well said. Yeah, thank you. Which bone do I have this over on my knee here, Miss Green? Miss Green? Miss Green. You blinked
Hello?
it. There you
Sorry,
go.
I don't know what was wrong with my mic just now. My
You're
child's
good.
like,
You're good, Miss Green. Which bone is this? Is this thing over on my knee?
is that your rectus femoris?
No, that's a muscle. Stick with bones.
Oh, your patella? Or...
Yes.
Yeah,
Very
okay.
well done.
Sorry, thank you.
Don't be sorry. What type of bone is the patella? Starts with an S.
Is this a trick question? Is it like a knee bone?
It is a knee bone, but it's a particular type of bone that's wrapped in fascia that starts with an S.
Starts with an S.
Yeah,
Sesamoid?
Yes! It's a sesamoid bone. It's a bone
Okay.
wrapped in tendon. Very good. All right, thank you, ma'am.
Thank you.
Which 8 bones are these, Miss Abelos?
Hi, are this the carpals?
Those are the carpals. There's 8 carpals. Absolutely. Thank you, thank you, thank you. Which bones are these? There's several here, but they're all by the same name, in a way. They're all the same type of bone. Miss Clayton.
Phalanges?
Phalanges. She's absolutely right, guys. There's 3 phalanges in this picture right now. Yeah. Miss Clayton, what is the one on the tip of my finger called? It's phalange. It's what? Phalange number what?
2.
It is. She's right, by the way. It's phalange number 2 because this is phalange number 1. So this is phalange number 2, this is phalange number 2, and this is phalange number 2. So what do we call the phalange number 2 at the tip of my finger?
The mini-me? The minimus?
I love that. It is the one that is most distant from my body.
Oh, the distal
Phalange number 2.
phalange number 2.
Which would make this one down here, what would it be called?
Proximal phalange number 2.
Yes, ma'am. And the one in the middle would be called?
Intermediate phalange number 2.
Or middle phalange number 2.
Middle phalange number 2.
Yeah, good. So distal phalange number 2, middle phalange number 2, proximal phalange number 2. Well done. Thank you, ma'am. Thank you, thank you. Mr. Manzanares, I've got a collarbone up here. What's my collarbone called?
The clavicle.
Yes, sir, it is. Good job. Thank you. Thank you, thank you, thank you. What is this, like, breastbone called here, Miss Pugh?
The breastbone?
Yeah,
Like the sternum?
that is the sternum, yes. Thank you, ma'am.
Mm-hmm.
What is this little pokey thing at the bottom of my sternum called, Miss Everson? It's a tiny little pokey thing. Starts with an X.
Xiphoid process.
It is the xiphoid process. Absolutely. Thank you. Thank you, thank you. What are these first 7 ribs called, Mr. Craven?
True ribs.
True ribs. Thank you. What are ribs 8, 9, and 10? The next 3 ribs called, Miss Lee. These are true ribs. These next ones are called...
True ribs.
First 7 are called true ribs. What are the next 3 called? False ribs. You're right. Thank you, thank you, thank you. Good job, Miss Lee.
Thank you.
What are the last 2 ribs called, Miss Dimitruk?
Floating?
Floating ribs. That's exactly right. Yeah. Thank you, ma'am. How many cervical vertebrae do I have, Mr. Godot?
Can you say that one more time?
I sure can. How many cervical vertebrae do I have that make up my neck?
I want to say 7.
I want you to say 7.
All right, 7.
All right, 7 it is. Awesome. Thank you, Mr. Godot.
Thank you.
How many thoracic vertebrae do I have, Miss Young?
5. I said 5. Am I right? No? Am I remembering it wrong?
Well, if it's a thoracic vertebrae, it's associated with what?
Is it 12?
It is 12. Because thoracic vertebrae are associated with ribs. And so you got 12 ribs, you got
confused. I knew the first one. I forgot the number of the second one.
7, 5. I mean 7, 12. No, I said it wrong. All right, 12 thoracic vertebrae. Thank you, Miss Young. Yeah. How many lumbar vertebrae do I have, Miss DeBose?
5.
5. Thank you very much. What is the first one called, Miss DeBose?
L1.
That's right. What is the last one called?
L5.
Yeah, what comes after L5 if you keep moving inferiorly? What's below L5? What bone? It's an upside down triangular bone underneath L5.
Is that not your sacrum?
It is your sacrum.
Okay, I was like, wait.
Good. Thank you, ma'am.
Okay.
The hips are made out of 3 bones. The hips are actually made out of 3 bones. What are those 3 bones, Mr. Overman?
You have the ischium, the pelvis, and the ilium.
Yeah, can you give me a different name for
Ischium's
pelvis?
not right, is it?
Ischium is correct.
Okay, a different name. Pelvic.
Pubic?
Pubic.
Good. So what was that again? Ischium, pubic?
And ilium.
Yes, ilium. Ischium, pubic, and ilium. Yep, cool. And the one I'm sitting on back here, everybody, your ischium is in your tuschium. You can actually feel this bone back here. The one I'm pushing on here, pubic. Up here, ilium. This is the crest of my ilium, and there's more ilium than that. But the point is ilium, pubic, ischium. Cool, cool, cool. I love that. Which phalange is this, Miss Suriel?
Oh my God. You got me. I don't remember.
Well, we have to number them. You got 14 phalanges in here.
Oh, it's number 1. I thought you asked for like a particular name. Yeah.
Yeah, well, that is its name. It's number 1 phalange. But the problem is I've got 2 phalanges in here. So what do I call this one right here? The one that's most distant from my body.
Distant number 1.
Pretty close. Distal phalange number 1.
Distal phalange number 1.
And this one is the closest in proximity, so it's called proximal phalange number 1.
Phalange. Okay.
Cool. So what's this then?
This is number 5. Phalange number 5.
Okay, but I've got 3.
Medial. Oh my God. Yeah. It's proximal. No. Distal phalange number 5.
That's right. Distal, it's farthest away from you. Phalange number 5. So what's this one?
Proximal phalange number 5.
Yes, ma'am. And this one in the middle is just called middle phalange number 5. Well done. Thank you. Thank you, thank you, thank you. Trying to think of any other. I mean, we've got lots of bones, but what is the name of my heel bone, Miss Osuna?
Can you hear me?
I can hear you now, ma'am. What's the name of my heel bone?
That is the calcaneus.
The calcaneus is my heel bone. That's correct. Thank you, thank you, thank you. What is the name of my jawbone, Miss Carrillo?
Is that the mandible?
It is the mandible, the manly mandible. Yes.
Can't be a cannibal without your mandible.
That's right. You can't be a cannibal without your mandible. I love it. Awesome. And every gallon fella has a patella. Okay. I don't even know if this is fair to ask, but I'm going to start asking stuff. What is the name of the process that is my elbow? My elbow is actually a process of my ulna, and it has a name. This process has a name, Miss Savarino.
You said the process has a name.
Yeah, so processes are bumps on bones, and this is my ulna because it goes to my pinky, and your elbow is actually your ulna. It is your ulna bone, but this bump actually has a name, and it's called and people don't actually massage therapists don't call it your elbow. They call it this process. They call it starts with an O, and it sounds a little Irish.
Okay, see, my mind is just going blank. Is it like, yeah, Mr. Sears, help me out, because all I'm thinking is weenus growing up. That's the only thing coming to my brain right now. I'm so sorry.
Miss Savarino, I'm not surprised that weenus and other rhyming words are in your brain right now. But yes, Venus is the skin on there, but this is the bone, and it sounds
it's
like
not like the chromium process.
yeah. Oh, sorry.
No.
No.
I thought that was no. That's like your shoulder, right?
Yes, thank you.
No,
No, I'm
it's
drawing.
aquarium.
No, it's olecranon.
I'm sorry, the pronunciation. Olecranon.
Olecranon.
Olecranon. Oh yeah,
Yeah.
that was completely.
Sounds like leprechaun. Olecranon. Olecranon process. Sorry, Miss Savarino, that was not an easy question. We haven't talked about it in a long time. But by the way, just so you guys all know, massage therapists, they call this the olecranon process. They don't usually call it the elbow. It's the olecranon process.
Olecranon process.
Yeah. Yeah.
Perfect. Thank you, Mr. Tascott.
So like you wanted to, when Mr. Ma told us that story, you wanted to put your olecranon process in that doctor's face.
That's
not the
that's
doctor's
a
face, the
damn
front desk
fact.
people's face. Yes. Gotcha.
Honestly.
There you go.
Me. Thank you, Mr. Tascott.
Thank you. Boom. What is the name of my shoulder blade, Mr. Ma? What do we call a shoulder blade? That triangular bone back there.
Scapula?
Scapula, thank you very much. Yeah. The scapula, I don't have a scapula in front of me. Darn it. That's not very helpful. Hold on, everybody. Let me grab one. All right, we're going to take the scapula. I am recording this session. I remembered. Thank you, Miss Osuna. This is a scapula. What is this point down here called, Miss Rader?
The inferior angle.
Yes. What's this point up here called?
Show me.
Yeah, still you. I'm going to stick with you for a second.
Superior angle.
Thank you. What's this border called?
The medial border.
Yes. What's this border called?
Lateral border.
Yes. What's this fossa called here?
The glenoid fossa.
Yes, which is why this becomes the glenohumeral joint, right? This is your shoulder joint. Yeah. What's this line here called?
The spine of the scapula.
Yes, and it turns into the what?
The acromion process.
Yes. This little beak, it's really hard to see in the camera, but this little beak actually pokes out in the front here, right here on my chest. What's this point called? This beak?
The coracoid process.
Yes. So now you know you're looking at the front of the scapula, believe it or not. It would be in my back here, but you're looking at the front side of it here. What's this fossa called here?
It's got scapular fossa.
She's right. Let's go to the back side. What's this fossa called?
Infraspinous fossa.
Yes. What's this fossa up here called?
Supraspinous fossa.
Nicely done. Really well done. Thank you. That, folks, is an entire scapula right there. Awesome. What is this bone right here called, Miss Deng? Miss Deng?
Yes.
Miss Deng, what is this bone?
This bone called
It's
humerus.
yes, it's very funny. It's called humerus. Thank you, Miss Deng. All right.
Thank you.
Mr. Jones.
One question.
What, do you have one question for me, or I'm only allowed to ask you one question? Is that what you're telling me?
Oh no, one question for you.
All right, one question
Oh,
for
did
me.
they name the funny bone because it's on the end of the humerus? Like, do those things go hand in hand, or was it just coincidence?
I think they named the funny bone because it is on the end of the humerus and it gives you a shock when you hit it. Yeah.
Right. Okay. I was
Yeah.
just
I don't know that
because
for a
I
fact, but
realized-
I've always thought that. I've thought the humerus was called the humerus just not because it's funny.
Yeah.
But then when you hit your elbow, people will be like, oh, you hit your funny bone, which is kind of true.
Yep.
Yeah, exactly, because it's funny when it does. Although it's not funny, it's kind of really annoying. But anyway,
It's horrible.
yeah,
Make your pinky hurt.
it's a bad joke. Sir, I feel like, I don't know, a week or so ago, you and I actually talked about the quads.
Yep.
And that's very important. You're a weightlifter and all that kind of stuff. They're a fairly important group of muscles. What are the 4 quads, by the way?
All right. So you have your rectus femoris. That's the big long one. Goes over 2 joints,
Yes!
hip and knee. All right. And then you have oh man, I always get the hamstrings and the quads confused. So you have vastus lateralis, vastus intermedius, vastus longus,
No.
or no?
You had a lateral, so you must have a...
Why can't I think of the name?
Well, there's lateral, and then there's what?
Medial,
Okay, so you got a vastus lateralis and a vastus...
intermedius,
and a vastus...
medius,
There you go. So
and then the
vastus...
rectus femoris.
Yes, vastus lateralis, vastus intermedius, vastus medialis, and rectus femoris. Yes, and I do love that when you talk about rectus femoris, you mentioned it's the only one that goes over both the hip and the knee. All
Yeah,
4
got
of
that memorized.
yeah, which is good. All 4 of these insert into what?
Ooh, pes anseritis
No, that's down
Oh.
here.
into the tibia.
Yes, into the tibial tuberosity, to be really specific. Via the what? How do they get there?
Ooh, the patellar ligament.
Yeah, pretty much. So everybody, all of your quads hook into your kneecap. That's what your kneecap is there for. All 4 quads. Hook into your kneecap. That's why it's called a sesamoid bone. And then your kneecap hooks in to your tibial tuberosity. Which is why when they pull, they do that. What do you call this, by the way, Mr. Jones, when I do that?
Extension.
Yeah,
Of the
extension.
knee.
Yep, of the knee. Awesome. Everybody, we're going to take a 15-minute break there. We're going to come back and do some more of this because we're going to talk about muscles when we come back. Two-headed muscle on the femur. by.
Semi-tendinosus or?
Yep.
No?
Yep. Keep going.
Semi-membranosus?
Yep. And what's the third one? By.
It's the, forgot the word, but,
By.
bicep femoris?
Yes. So what were those three again?
Bicep femoris, semi-tendinosus, semi-membranosus.
Good. What was the three calf muscles?
Gastrocnemius, soleus, and plantaris.
Good. What are the three hamstring muscles?
Sorry, I don't know. Semi-tendinosus, semi-membrosus, and bicep femoris.
Yes. Good job, sir. Stay with me for a second. What are the three gluteal muscles?
That's gluteal minimus, gluteal medius, and gluteus maximus.
Nicely done. What are the three erector spinae muscles that run up and down my back?
This is the trapezoid.
No, not. You're thinking of the trapezius. These are the three ones. One runs right next to the spine. One is really long, and the other one runs from the ilium along the ribs or the costals up to your head.
Longissimus dorsal, or
Longissimus is one. Then there's one next to the spine.
Stenosis, something like that? Or?
Spinalis. Good. Spinalis, longissimus, and one from the ilium to the costals. Sounds kind of Spanish.
Iliocostalis?
Yeah, iliocostalis. Beautiful. So what were those three again?
It's iliocostalis, longissimus dorsi, right?
Longissimus.
Oh, just longissimus?
You're getting mixed up with latissimus dorsi. Don't think about that.
Oh,
Right
okay. Longissimus, and you say I forgot again.
The one next to the spine? Spinalis?
Yeah. Spinalis?
Yeah. So what are those three again?
Spinalis, longissimus,
Yeah.
and iliocostalis.
Yes. Yes. That's good. Awesome. Shoot, I'm sorry. I'm getting kind of old. What were we talking about? Oh, that's right. The three erectors to the back. What are those called again?
Iliocostalis, longissimus, and spinalis.
Yeah. Okay. So let's review. What are the three calf muscles?
Gastrocnemius, plantaris, and soleus.
Yes. Three hamstrings.
The hamstrings are the semi-tendinosus, semi-membrosus, and the
You do it. It's okay. This is very stressful, and you're
my
doing very
brain's not
well.
working today.
Two-headed by.
Bicep femoris,
Yes. And what are the three gluteals?
the gluteal minimus, gluteal medius, and gluteal maximus.
Yes. And what are the three spinal erectors?
It's iliocostalis, seminosus over
Spinalis.
spinalis, and iliocostalis,
One's really long.
longissimus.
Yeah.
Right.
So let's go through them again. I just want to make sure I leave you with all these stuck in your head. What are the three calf muscles?
It's gastrominimus, plantaris, and soleus.
Yeah, gastrocnemius, plantaris, and soleus. Yep. What are three hamstrings?
Hamstrings are the semi-tendinosus, semi-rhombosus, and bicep femoris.
Yes. What are the three gluteals?
Gluteus minimus, gluteus medius, and gluteus maximus.
Yes. And what are the three erector spinae muscles?
Iliocostalis, longissimus, and spinalis.
Yes. And now I can leave you alone. Good job, sir. Thank you.
Okay. Thank you.
Mr. Ma. Mr. Ma? Mr. Ma?
Yes, sir. Yes, sir. I'm here.
Okay, good. I believe you. Mr. Ma, let's do some really quick muscle review, okay?
Okay.
How are you feeling today?
I'm feeling good.
Good. Good. All right. What are the 3 calf muscles?
Gastrocnemius, soleus, plantaris.
Good. There's 2 more muscles underneath those. Do you remember what they're called?
Yes, I think so. Sorry, hold on.
We can't hear you, by the way, right now, sir.
Can you hear me, sir?
Yeah, now we can hear you. Thank you.
All right.
So there's actually 3 muscles underneath those. Sorry, 4. Depends on how you want to count it, but
Actually, sir, I cannot remember that. Another 2.
well, there's definitely 3 more underneath the calf muscles that help to pull your toes down or your foot down or something. What do we call this when our toes curl under?
The big toe.
Big toe or small toes? What action is this?
The flexor.
Yes. So we are looking for 2 flexors. One flexes the big toe, one flexes the other toes.
Oh. Is that flexor digitorum longus, right?
Yes! Flexor digitorum longus, and what's the one that does the big toe?
Oh, so that would be flexor hallucis longus. Huh?
Yes. And then what's the muscle found behind the tibia?
Oh, tibialis posterior.
Yes! And then what is the key that unlocks the knee?
What is the question again, sir? Sorry.
It's not a great question. There's a muscle that actually helps to it runs just right behind your knee. It's right back here behind your knee. It's tiny. And some people call it the key that unlocks your knee because it helps to unhook your knee a little bit. And it's in the popliteal region.
Is that called popliteus?
Yeah, popliteus. Well done.
Uh-huh.
All right, just a couple more questions, sorry, and I'll let you
Sure.
go. In front of your leg, we've got 3 more muscles. 2 of these help to pull your toes out.
Oh, it's supposed to be extensor digitorum longus.
Yep.
And extensor hallucis longus.
Yep, and there's a muscle in front of the tibia.
So that is the tibialis anterior.
Good, and 2 last muscles left in this leg area that are on the side of the leg.
Oh, that one would be is that called
Yeah, beautiful. Peroneals. Peroneus longus.
peroneus longus and
Yep.
peroneus brevis.
Yep, or fibularis longus and brevis. Nicely done, Mr. Mull. And I didn't ask the questions very well, so I apologize. All right, everybody.
Thank you.
This should actually lead us into our discussion today. I just want us to briefly look at the extensor digitorum longus and the extensor hallucis longus because these muscles do get achy on people, believe it or not. They're fairly tiny muscles, and they get achy when they walk a lot because they're constantly lifting their toes up. And so let's take a look here. This kind of leads, Mr. Ma led us into our discussion of actual muscles here. And I'm going to show you tibialis anterior as well, because it really is an extensor of the foot, even though we don't call it that, right? Okay, you can see all this. We are good to go. Boom, boom, boom. Okay. So, when you do a dorsiflexion, which is when you lift your toes up to stop a door, a dorsiflexion. I don't like that they call it that. I wish they called it like a dorsi-extension or something. Because to me, you know, that's kind of what we're doing. But if you do a dorsiflexion, which is a movement of your ankles, when you lift your foot up off the ground, your toes up off the ground, as in to stop a door from slamming on you or something, your main muscle that does this is the tibialis anterior. But I hope you can also see that the extensor digitorum longus and extensor hallucis longus, if they pull on your toes hard enough, they will end up pulling on your foot. I'm showing you all of these together because we need to start thinking about group actions now. We've been doing stuff in small little groups one at a time, saying, hey, this muscle does this, but rarely do muscles work alone. And so if somebody comes into you and they're achy from hiking or something like that, notice that they're having a hard time lifting their toes up, you would look at all three, well, their toes you wouldn't, but the point is if they're having difficulty lifting their foot up, you look at all three of these muscles. It also lets you know where they lay on somebody's body. So the anterior tibialis really is most anterior. And here's the extensor hallucis longus, and here's the extensor digitorum longus. When you're rubbing somebody, by the way, these feel like the same muscle. If we go even more lateral, we get to the peroneals. They're right here. So now you can actually rub somebody's shin and know what you're touching. You can actually run your thumb down here and be like, anterior tibialis, extensor digitorum and extensor hallucis longus, peroneus or fibularis longus, and brevis on the outside. Anyway, these three muscles, though, tibialis anterior, extensor digitorum longus, extensor hallucis longus, help to do a dorsiflexion. They help to lift the foot up. Yeah? Let's look at the tibialis anterior. Arguably probably the most important muscle of the front of your shin. This muscle gets sore on people a lot. You will have people come to you and they will say, I have shin splints. Back in the day, before the dawn of time, when I was a massage therapist, shin splints really meant that you actually had hairline fractures in your shin, either your tibia or your fibula, usually your tibia. And those were called shin splints, and they were very painful, and it can still mean that. To this day, it can still mean that. But even the medical industry today uses shin splints to mean usually any pain in your shin. And it really usually is also just stress from the tibia and these other muscles pulling on the interosseous membrane of your leg. What is the interosseous membrane, you might ask, Tapscott? Well, the tibia and the fibula are right next to each other, and they have a membrane between them. And yes, it's fairly thin, but remember, this is fascia. These membranes are very, very strong. You have the same thing between your forearms. It helps to give them strength, to tie the two rods together. And because there's a membrane there, by the way, so that nerves and veins can pass from the back of your leg to the front of your leg, and it makes your fibula stronger and all sorts of stuff. But because there's a membrane, the tibia is not just hooked to the tibialis anterior is not just hooked to the tibia, okay? It is. It's hooked to the lateral condyle of the tibia and the anterior and lateral surface of the tibia, but it's also hooked to the interosseous membrane. So you've got this periosteum that's around the tibia, periosteum that's around the fibula, which is fascia around those. You've got an interosseous membrane wrapped around all that fascia, and you've got muscles glued to it front and back. And they pull on that, and it literally makes you feel like you have an ache in your bone. And so people call it shin splints, even when it's probably not really shin splints, but don't correct them, because now in this day and age, we now use shin splints to mean just about any type of pain down in that area. I don't even think it'd be improper to tell a doctor that I have shin splints. I don't think they'd correct you. That could mean hairline fractures in your tibia from impact from running, but it could also just mean this pulling on your membranes down there, your interosseous membrane, and the membranes around your bones, the periosteum. Periosteum is this membrane around your bones where the tendons really hook into. So this guy is glued to the front of your leg here. And then he finally breaks through and sends a long rope down here that inserts, as we've already discussed, into the medial, this guy right here, the medial cuneiform and the base of metatarsal number 1, the first metatarsal number 1, the base of the first metatarsal. By the way, from the other side is the peroneus longus coming along to insert in that same place, but that's beside the point. This muscle is also, it's in front, and it I know it hooks underneath, but it's in front, it's coming from the top. So when it pulls on the foot, it can cause a dorsiflexion. And because it goes to the medial side of your foot, it can cause your foot to turn inward, right? Which is an inversion, to invert your foot, right? So if this is really tight on people, they will walk on the outsides of their foot, actually. I don't know if this camera's going to let me show you, but they'll actually walk on the outside of their feet if this is really tight, because it's causing them to invert their foot. And you can elbow this muscle if you're careful not to hit the shin bone, which is this shaft right here. The nice thing is it's so easy to find this muscle, because you literally find the shin bone and you fall lateral a quarter of an inch. You're on it. You're on it, and you can go deep, deep, deep into it as long as you go slow. Mr. Bose, please.
Why do some children walk on their tippy toes?
Actually, for all sorts of reasons that I don't know. I mean, I don't know because it's different from child to child.
Mm-hmm.
Sometimes they are learning to walk, and so it's just their interpretation of the ability to walk and such. I have known people to walk on their tippy toes all the time because their muscles that help them plantar flex are permanently shortened because they've worn high heels, for example, all the time.
Oh,
I used to date a girl that lived in high heels. She really did, and she really couldn't put her feet down flat because the muscles that helped her plantar flex were all shortened. And so to help her, I had to lengthen those muscles that would help her to plantar flex so that she could get her foot back down. Yeah. By the way, you might get a client that comes to you, Mr. Bose, with that. So what are the muscles that help you to plantar flex? What muscles would we lengthen?
Or calf muscles.
That would be the first ones. What are those three?
The gastrocnemius, soleus, and plantaris.
Yes. What other muscles back there also help me to plantar flex, even though that's not their main job?
Hold on. We just talked about this. Why?
That's why I'm asking it.
Yeah, Mr. Coxon, I forgot. Hold on.
You'll figure it out.
Yeah.
They're back there. They're underneath the gastrocnemius, soleus, and plantaris. They're in the back of my leg. One's in the back of my tibia. The other two are back there too. They reach under, grab my toes.
The tibialis posterior.
Yep, that's an important one.
And what the heck, Sky? Hold on.
What do you call it when your toes go under?
Under.
Yeah. What do you call it when they do? I mean, when you curl your toes.
Oh, is it the flexor? Yeah. I need help, Mr. Top Scott.
Well, what do you call when you curl your toes under?
Isn't that flexion?
Yes. So what are the muscles called that flex your toe, your foretoes, and your big toe?
Oh, isn't the flexor hallucis longus and the flexor hallucis brevis?
Flexor hallucis longus, and what flexes the rest of my digits?
And the extensor? The flexor, I'm gonna cheat. 1 second.
Why don't you just listen to me? What is the other muscle that flexes the rest of my digits?
Oh, the flexor digitorum longus.
Yes. Okay, so we've got the soleus, plantaris, gastrocnemius, flexor digitorum longus, flexor hallucis longus, and tibialis posterior. And I'll just throw in, just to make it simple, the fibularis longus and brevis. Cool. Those are the things you would lengthen on somebody who had them kind of permanently shortened from walking on their toes. Thank you, ma'am.
Thank you.
Miss Rader, you raised your hand. Probably had a comment.
I'm just curious if you know, is it these muscles that cause people to have like the overpronation, like when they're running and stuff like that, where their feet tilt in or they tilt out? You know what
Yeah.
I'm talking about?
Yeah, yes. Oh, by the way, short answer, yes, 100%. So if you're talking about the tibialis anterior and the peroneals, those are
Yeah, but
those are your, I forget, is overpronation, I think, is eversion.
yeah.
And so that would be peroneals.
So it's something to do with the muscle. So it's something that can be fixed then.
Yeah. Oh, yeah. I mean, by the way, they might have other issues. I'm not saying that every last person, but yes. Yeah, sometimes this is just about lengthening these muscles out. Sure. Yeah.
Okay.
The only problem is, by the way, 100% yes. I've worked on it before. Yes, 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 all day long. The thing is, you start to affect hips and all the way up the body when they have these problems. That's why you want to try to fix it too. And they could have something, anybody could have something permanent and structural in their body, the way their bones are made. But yes, you can have tight tibialis anterior and be inverted, and you can have tight peroneals and be everted. Yes. Yeah, and you would want to work on those. Yeah, absolutely. Mr. Richards.
So my nephew, he was walking on his toes most of his childhood, and when he was about 7 or 8, he had to have his Achilles tendon cut because it was constantly short. So they had to cut it and lengthen it somehow. Why would they do that?
Because he went to a surgeon. So that's kind of a smart-ass answer, but it's really true. If you go, and it's not putting down surgeons, but if you go to a massage therapist and ask them how to solve a problem, they're going to stretch and rub you. If you go to a surgeon and ask them how to solve a problem, they're going to cut you. And
if he was in plantar flexion all the time, why wouldn't they just strengthen the muscles?
They should have just had him start doing a stretching routine. He's young, and he easily could have stretched that Achilles tendon back out. I mean, look at young kids that can do splits and everything like that. There's no doubt in my mind, at least, that he could have easily, it wouldn't have happened overnight, but they could have easily stretched that tendon back out because that's how your body works.
Well, he did used to wear these shoes that tried to help him do that, but apparently that didn't work. So then they had to cut it as a last resort kind of thing.
And maybe there's some other condition going on, but it just sounds really drastic. But yeah.
So when you do plantar flexion, your Achilles shortens, right?
Right. It's shortening, and not really even your Achilles shortens, the contractile tissue of your gastrocnemius soleus and plantaris, and possibly your tibialis posterior, and possibly your flexor digitorum and flexor hallucis longus, and possibly your peroneus longus and brevis. But anyway, those muscles shorten, and yes. And so what they did was they added length to his calcaneal tendon. Yes.
Thank you.
Yeah. Miss Carrillo.
So I was kind of like in a really deep thought. I was really pondering of when you said that when the calves do get you on your tippy toes, right? And they're very strong, and it made me think about how we were wondering why these are known as flexors instead of extensors. And you made the example of the jaw. And I was wondering if it's because of the power that's needed, because the same thing is kind of like with the hands. If they go this way, we need them to flex to grip. And I think it's because these are powerful actions, and that's why it's considered flexors instead of extensors. Because we're like, but it's lengthening the feet with the leg, right? Usually that would be an extending, but we call it flexing, and we're always wondering.
Well, we call the toes work just fine. The toes curl under, and that's a flexion. They go out. That's an extension. It's the ankle movement that gets very confusing.
Yeah, and then I was wondering if it's because it's supposed to help with the very powerful movement to assist with the calves, and we could argue about the low backs to extensions, and those are considered very powerful. But I think the difference is how far, because flexion we can go like really close, and in front of the body when we do a flexion we can almost get to our knees. And I don't know, I was thinking about it, and I need to talk about it.
Okay. Flexions normally close an angle. And I think with your foot, they decided we're gonna call them both flexions, and with the top of your foot is called the dorsal region. When the dorsi comes closer to the shin, that is a dorsiflexion, closing the angle. When the plantar region comes closer to the back of the leg, we're closing that angle. We're going to call that a plantar flexion. I mean, I think that's
I
the
totally
logic.
forgot about dorsiflexion. I always forget about that one.
Yeah.
Hey, thank you. Thanks for
Thank you.
listening to my rant.
No problem. No problem. I love a good rant. Ms. Avalos, please.
Yes, sir. The interosseous membrane, is that the tibiofibular joint
No.
that they discussed?
No. The tibiofibular joint is your knee. I'm talking about an interosseous membrane between, you can see the skeleton here, between these two bones. There's membrane in here, filled in all in here.
Well, the knee's the tibiofemoral joint, right?
Yes, I'm sorry, what did you say?
So the tibio.
Oh, the tibiofibular joint. I'm so
tibular
sorry.
Joint.
Miss Avalos, you said it right. I heard it wrong. It is not, but you're right. There is a joint right there between these two bones here and here. But no, there's an interosseous membrane between the two also.
I thought it was that membrane was like a fibrous joint, and it's in the middle. So that's like one of the. We only have 3 areas, I believe, that have fibrous joints, and that would be the forearms, the calves, and then the sutures on the head. Those are fibrous.
I've never thought of the interosseous membrane as a fibrous joint, but I'm cool thinking of it that way, yeah. Yeah. I don't know if your book classifies it that way, but I get your logic and I would agree with that. It's not a synovial joint. It would make more sense to call it a fibrous joint. Good thinking. Yeah. It's not in a joint capsule. And yet there is movement. You're absolutely right. Just like my arms. We don't realize this, but my arms actually roll, one bone rolls over the other when I do that. And that's because the interosseous membrane can move, which kind of makes it a joint, and calling it a fibrous joint makes a lot of sense in my brain. Yeah. Okay, tibialis anterior. Moving right along, so we have time to get through everything else. We've got 2 other things to discuss, which is extensor digitorum longus. If you see tendons going down to toes on the top of the foot, from up here, you should know this is the extensor digitorum longus. And look, it's going through retinaculum called the extensor retinacula. Anyway, it's running down here. This is what you see on the top of people's feet. You don't see their bones on the top of their feet normally. You're seeing their extensor tendons. Here's their extensor hallucis tendon anyway. By the way, extensor digitorum longus, it likes to attach onto the tibia too. It starts to grab onto the fibula, and what's between the tibia and the fibula? Interosseous membrane. So it grabs on there too. So this thing will make people ache too. And by the way, when I'm rubbing the tibialis anterior, which is right here, I don't make a distinction between these two. I just hit them both. They're all right there. Okay? Later, this will become important. I'm not going to worry about it yet. But when this guy inserts down in your toes, it inserts in 2 places. It inserts into the middle phalanges and the distal phalanges. Middle phalanges and distal phalanges. So it grabs onto 2 sets of phalanges down here. We'll talk about this more later. And let's go to the extensor hallucis longus. It cannot insert into the middle phalange because there is no middle phalange on your big toe or your thumb. And it likes to also grab onto the interosseous membrane, and it's far enough over that it grabs onto the fibula. So, but same concept, and runs down and grabs on to the distal phalanx of the first toe. It grabs onto the last bone of your big toe. Yep. Boom. Right from there. So, in this, what we call the anterior compartment of the leg, you've got 3 muscles. We've got, come on, back with me. Yep. We've got, come on. My keyboard is going very short. I won't do it. All right. We've got 3 muscles in the, there we go, finally. We've got 3 muscles in the anterior compartment of our leg, right lateral to the shin, but it's the front of our leg, and that's the anterior tibialis, the extensor digitorum longus, and the extensor hallucis longus. If we go to the lateral side of our leg, we got the peroneals. If we go to the back, we've got all the calves and all the flexors. But today, you now know what lives on the front of the shin, essentially, besides the shin bone. But you go a little bit lateral, and you get anterior tibialis, extensor digitorum longus, extensor hallucis longus. Cool? All three of those help in a dorsiflexion. All three of those are overlooked muscles. The reason I'm making such a big deal out of them is they're overlooked muscles, and most massage therapists don't even massage the front of the shin. They don't do it. They just skip it. Or by the way, showing they know nothing. Sorry, this is one of my massage pet peeves, but it really annoys me, especially when I'm on the table. They rub over it gently, like this, like they're giving me a facial. I want that pressure for my face. The anterior tibialis, by the way, just so you guys understand, can take a tremendous amount of force. I am 52 years old and I just hit my leg as hard as I can, and there will be no bruising tomorrow and it will not feel sore. You can take a bat to it. And if somebody is an athlete, they will thank you for taking a bat to it, and you will steal yet another client. In fact, Miss Severino didn't tell you today, but that's how she stole the client. She just had them lay down on the table and she just rubbed the front of their shin, and they're like, nobody's ever done that to me. I've had 4,000 massages, but nobody's ever done that, because nobody does ever do that out there. Dig into those suckers if people will allow you to. Now, I'm not saying just, don't pay attention. There are some people that are highly sensitive down there. But in general, you can drive an elbow through there, and in general, the sweetest little people can take a tremendous amount of pressure down there, and they're sore. They ache in the bone. All of you go out for a long car ride or a long hike and come back and tell me you don't ache in your shins. And that's what you want to get to. And what makes a really great massage therapist, by the way, first and foremost, is people skills, which you all have. You're lovely human beings. But then it comes to doing all the stuff other massage therapists don't do. Other massage therapists don't get the pressure right. Other massage therapists don't keep the pressure right and stay in there. Other massage therapists skip over tricky spots like the shins. Other massage therapists don't get into the hips. They don't get into the feet. They do this little foot thing too. And I'm like, what are we doing? Don't touch an area if you're not going to do therapy on it. Just don't bother. Don't touch it. Don't insult it if you're not going to do therapy on it. So this is one of those areas that I think you should insult and assault. I'm going to release your homework here. Your homework, it's not a lot, I don't think. And hold on, Mr. Richards, please talk to me.
My externship guy's just called me, and he only works Monday, Tuesday, Thursday, and Friday.
Oh, okay. Are you okay? Can you do that with him?
I can, but I'm just thinking of the last week, because aren't we back in school on that Friday?
Yeah, but you and I...
We do Monday and Tuesday, don't we?
Yep.
And they're the last 2 days, but then we've got Wednesday and Thursday.
Yep.
Of that last week, so I just come to class on that Thursday instead of with him.
Yeah, you could do that for one thing. You could do all that, or you could start a Friday early with him instead, and then be off. Does that make sense? I'd have to look at it on a calendar for it to make sense in my brain too. Let me go look at it. But as long as you're...
So many hours, right? I have to do how many hours a day?
6 hours a day. I need you to put in 24 hours a week.
Okay.
We can be flexible how you do it. That's totally fine. And you and I can work something out. Please, I think this guy is just I think you're going to really be happy about this externship. Hold on 1 second, sir. I'm going to look on a calendar, but I want to tell everybody really quickly. You have 2 homework assignments, everybody. A 13-question test, number 67 on the foot flexors, and matching on chapter 1 of your book on the history of massage. We're going to talk about the history of massage tomorrow. And let me look at a calendar, sir. So he does Wednesday and Thursday, though, sir. Is that right? Or Wednesday and Friday?
He only does Monday, Tuesday, Thursday, and Friday. He doesn't do Wednesdays.
So you could do Thursday the 27th and Friday the 28th with him, right?
Which would make up for the Wednesday, right?
Which would make up for the Thursday you're missing. This Thursday, right?
Wednesday, because we do class with Monday and Tuesday, then we'd go externship Wednesday, Thursday. So if I do Thursday and Friday, that'll make up for Wednesday, right?
Yes.
Then the following week, I just do the Monday, Tuesday, Thursday, and Friday, but that would complete one more week. And then the following one, I'll do Monday and Tuesday with him. Then I'll be in class normal on the Thursday.
Yeah, actually, you'll have done the whole thing.
Okay.
Yeah, it's going to work either. Yeah, you're fine. That's beautiful. Thank you. Are you? And you're okay. And you're okay with that?
Oh, I'm great. Yeah.
Okay.
He sounds nice.
He is.
Thank you.
Here, the reason I'm so gun ho on this guy, and I'd forgotten about him until you request him, he just selflessly likes to teach, and he seems to have no ego about it, and he's brilliant. And he does really neat stuff and like scar stuff internally in people, and he really knows his stuff. And I just think you're going to find it really interesting. Other students that have come back have said, yeah. And I just think, I just think it's a really neat experience. Yeah.
Thank you.
Thank you. So I'm looking forward to it. I appreciate your flexibility because I know it's not easy to change schedules around. Does everybody see their 2 homework assignments?